Assalamualaikum madam, my name is Nofatin Azwani binti Azman, PC 04180069. I will present to you my group members and the topic we will present. My group members name is Nur Shazwana binti Anwar, PC 04180071, Nur Sharafinas binti Abdul Malik, PC 04180070, Nur Ashikin binti Karim, PC 04180072, Noris Amalina binti Ismail, PC 04180075. We will present about benign prostatic hyperplasia. Before that, I want to apologize because my group didn't get a live presentation because one of my group members having a bad line. So I will continue to my explanation. For learning objective, we learn about definition of BPH or benign prostatic hyperplasia, and my group will explain about pathophysiology, etiology, clinical complication and medication of BPH. For definition of BPH is enlargement of the prostate gland. Prostate gland is part of the reproductive system located under the bladder. It because of tissue growth in the glandula. Most commonly occurs in men over 50 years old. This BPH happen because mereka suka menahan kencing. Thank you. Next slide explained by Shazwana.
Assalamualaikum madam, my name is Nur Shazwana binti Anwar, PC71. Today I want to explain about pathophysiology of benign prostatic hyperplasia. So macam madam nampak dekat slide saya ada letakkan secara details apa itu pathophysiology untuk penyakit BPH. Tapi sejujurnya dalam slide ni dia adalah penerangan secara ringkas dan banyak terminologi yang kompleks dan susah untuk saya explain. Jadi saya juga sertakan satu flowchart dalam slide ni. Tapi saya akan explain dekat madam dengan secara lebih ringkas, iaitu sebenarnya prostatic enlargement ni saya akan terangkan secara ringkas. Yang pertama, prostatic enlargement depends on the potent androgen dihydrotestosterone (DHT) in the prostate gland. Type 2,5-alpha reductase metabolize circulating testosterone into DHT, which works locally, not systemically. Ini bermaksud dalam prostate gland, type 2-alpha reductase ni bertindak terhadap testosteron, bekerja pada bahagian prostate gland sahaja, bukan secara keseluruhan satu badan. DHT binds to androgen receptor in the cell nuclei, potentially resulting in benign prostatic hyperplasia. So, ini adalah secara ringkas apa yang berlaku kepada prostate gland yang menyebabkan penyakit benign prostatic hyperplasia. Seterusnya, saya disertakan beberapa faktor yang menyebabkan penyakit BPH ini. So, yang pertama, the first one is static anatomic obstruction of the bladder neck caused by an enlarged prostate gland. Anatomic obstruction ini bermaksud apa-apa blockage ataupun halangan yang menyebabkan urine tak keluar. Sebabkan kita ada enlarged prostate gland, sebabkan kelenjar prostat tu membesar. Untuk yang kedua, dynamic excessive stimulation of alpha 1A adrenergic receptor in the smooth muscle of the prostate, urethra and bladder neck, which result in smooth muscle contraction. Di sini bermaksud bila ada pergerakan ataupun stimulation yang lebih kepada reseptor ni akan menyebabkan smooth muscle bertindak dan memberi result kepada smooth muscle contraction. Sebab macam kita tahu, untuk smooth muscle contraction ni saya akan explain untuk next, iaitu distressor. Okay, yang ketiga dystrasa ni. Dystrasa is bladder dystrasa muscle hypertrophy in response to prolonged bladder outlet obstruction. So, this dystrasa muscle is actually a smooth muscle found in the wall of the bladder. The dystrasa muscle remain relaxed to allow the bladder to store urine and contracts during urination to release urine. And the bladder outlet obstruction in the slide is mean this disease occurs when there is a blockage at the base of the neck of bladder. Such of a blockage reduce or stop the flow of urine into the urethra, which carries urine from the body. Penyakit ni common dengan all the men yang selalunya ada masalah prostate problem. Contohnya seperti BPH yang sedang kita bincangkan sekarang. Okay, after that, prostatic enlargement is influenced by a combination of androgen, growth factors, estrogen and epithelial stromal interactions. Jadi, pembesaran prostate gland ni berpunca daripada combination of androgen dan beberapa faktor yang saya telah sebutkan tadi.
Assalamualaikum. My name is Nur Sharafinas binti Abdul Malik. My matric number is PC04100070. I want to present about diagnosis of BPH. Diagnosis of BPH have four, which is digital rectal exam, urine test, blood test, and prostate specific antigen blood test. Based on digital rectal exam, the doctor insert a finger into the rectum to check your prostate for enlargement. Number 2, urine test. Analyzing a sample of your urine can help rule out an infection or other condition that can cause similar symptoms. Number 3, blood test. The result can indicate kidney problem. Number 4, prostate specific antigen can substance produced in your prostate. PSA level increase when you have an enlarged prostate. However, elevated PSA level can also be due to recent procedures, infection, surgery, or prostate cancer. After that, clinical practice government of management is to treat option for symptomatic patient with BPH fall into four distinct categories. Category 1 is assurance and advice or watchful waiting. Category 2 is pharmacological intervention, use alpha receptor blocker. Category 3 is 5-alpha reductase inhibitors and phytotherapy. Category 4 is surgical treatment, use endoscopic treatment like TURP, TWIP or laser. Goal of the treatment for benign prostatic hyperplasia is reduce morbidity and prevent complication. Management of BPH have two: pharmacological management, drug therapy, non-pharmacological management, non-drug therapy. For this part, I will hand this part to my friends.
Assalamualaikum. Saya Narashkin binti Karim dari PC 04180072. Okey. Di sini saya akan menerangkan tentang pharmacological management of drug. Drug name yang pertama, the first drug name is I use is trazodone and the drug name is Hytrin. For the second drug name is dexazosine and drug name is Gardura. For the next slide, I will explain that drug therapy of the benign prostatic hyperplasia. In the drug therapy of benign prostatic hyperplasia, I will explain side effect and mechanism of action for the drug. for the first drug, I choose the group alpha blocker, which is alfuzosin or urextral. Side effect of this drug is can cause dizziness or lightheadedness. And the mechanism of action for this drug is relaxation of smooth muscle. Second drug, which is dexazotine or Cardura. The side effect for this drug is dizziness, lightheadedness, drowsiness, unusual tightness, or weight gain. And for the mechanism of action for the dexazotine, inhibit the postsynaptic alpha 1 receptor on the vascular smooth muscle. Okay, for the third drug is tamsulosin or Flomax. The side effect same for drug 1 and drug 2. Usually is dizziness, lightheadedness, drowsiness, runny or stuffy nose, or ejaculation problem. And the mechanism of action for this drug is relaxation of prostatic smooth muscle. And the fourth drug is trazodone or Hytrin. And the side effect of the trazodone is dizziness, lightheadedness, tightness, nausea, drowsiness, blurred vision, headache, or stuffy nose. And the mechanism of action for the trazodone is relaxation of smooth muscle in the bladder, neck, and prostate. Okay, maksudnya secara keseluruhannya kesan sampingan terhadap ubat-ubat yang saya sebutkan tadi dan tindakan ke atas ubat tersebut. Okey. Tindakan ke atas ubat-ubat tersebut secara ringkasnya adalah ubat-ubat ni dapat membantu untuk merelakskan atau menenangkan otot licin pada dinding pundi kencing supaya saluran akan berjalan dengan lancar. Okay, for the next slide, saya akan terangkan contoh gambar ubat berserta kekuatan ubat tersebut. Yang pertama adalah alfuzosin, which is 10 mg of tablet. The second drug is prazosin, which is 1 mg of the capsule. And the third drug is trazodone, 1 mg of capsule. And the last is dexazotine, 2 mg of tablet. Okay, for the next slide, I give to my friend to explain more about benign prostatic of hyperplasia. Thank you.
I want to explain about non-pharmacological treatment of benign prostatic hyperplasia. So the first one is advise the patient about double evacuation of the bladder. This means that after finishing to pass urine, the patient should wait for 30 to 60 seconds and then again pass urine. Although this should be done throughout the day, it is especially important to do so before retiring to bed. Otherwise, slight residual urine adds to nocturia. Slight residual urine ni bermaksud urine yang masih tinggal di dalam bladder. Maksudnya bila patient pergi tidur, urine tu tidak kosong sepenuhnya. Jadi akan jadi masalah macam kurang tidur ke. And then nocturia ni pula bermaksud lower urinary tract disease. Dia macam bila bladder tu tak completely empty, dia akan tendency towards penyakit ni, macam tu. So the number 2 is bladder training should be introduced if available in the physiotherapy department. Otherwise, the patient should be taught to empty the bladder regularly at 2 to 3 hours interval. 2 to 3 hours interval ni bermaksud dalam jangka masa yang dalam jarak 2 atau 3 jam untuk mereka belajar kosongkan dorang punya pundi kencing. The number 3 is pelvic floor exercise. The patient should be taught to contract the pelvic floor muscle to strengthen them. These muscles are ultimately responsible for the urine to pass out. This can be done as frequently as possible, even hourly, and also while working or even talking without any waste of time. So bermaksud, pelvic floor muscle ni, patient kena belajar untuk pastikan diorang boleh kawal. Dan cara nak buat pelvic floor muscle ni sangatlah mudah dan diorang boleh lakukan setiap jam. Even sedang bekerja ataupun sedang bercakap pun mereka boleh buat perkara ni. So finally, the lastly is number 4. Urethral milking should be taught to reduce as well as to hasten the post-micturition dribbling. Post-micturition dribbling ini adalah sebenarnya occurs when urine remaining in the urethra after voiding the bladder slowly leaks out after urination. So ni bermaksud masa patient dah kencing, bila ada penyakit ni dia akan menyebabkan bladder tu tak kosong. Bila tak kosong, dia akan slowly leak out. And then cara untuk mengelakkan perkara ni berlaku, patient boleh buat macam ni. After passing urine, wait for a few seconds to allow the bladder to empty. Place the fingertips of the left hand 3 finger breadths behind the scrotum and apply gently pressure. Keeping the pressure in the midline, gently but positively draw the fingers forward towards to the base of the penis under the scrotum. Ini untuk memastikan supaya di dalam bladder tidak ada lagi urine yang tertinggal dan tidak akan maksudnya tak akan terjadilah penyakit BPH ini.
Hello and Assalamualaikum. My name is Noris Malina binti Ismail. My metric number is PC04180075. Today I will explain topics counseling for patient. Medication number 1 is alpha blockers. Alpha blockers, which include alfuzosin, the brand name is Eurozetrel, and doxazosin, brand name is Cardura. Side effects might include dizziness, and a harmless condition is retrograde ejaculation. This medication relaxes bladder neck muscles and muscle fibers in the prostate, making urination easier. Usually work quickly in men with relatively small prostates, in which semen goes back into the bladder instead out of the tip of the penis. The medication number 2 is 5-alpha reductase inhibitors. This medication, which include finasteride, the brand name is Proscar, and dutasteride, the brand name is Avodart. Side effects include retrograde ejaculation and combination drug therapy. This medication will shrink your prostate by preventing hormonal changes that cause prostate growth. Might take up to 6 months to be effective. Your doctor might recommend taking an alpha blocker and a 5-alpha reductase inhibitor at the same time if either medication alone isn't effective. And the last medication is tadalafil or Cialis. Side effect: headache, stomach upset, back pain, muscle pain, stuffy nose, flushing, or dizziness may occur. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or laying position. Studies suggest this medication, which is often used to treat erectile dysfunction, but this medication can also treat prostate enlargement. If any of these effects persist or worsen, tell your doctor or pharmacy promptly. Next, we go to lifestyle changes or advice for patients. People with BPH can take action to relieve their symptoms without medication or surgery, particularly during the watchful waiting phase. They can try the following strategies to relieve symptoms. Number 1 is limiting consumption of caffeine and alcohol. Number 2, doing exercise to strengthen the pelvic floor muscle. Number 3, eating more fiber to help prevent constipation, which can worsen symptoms of BPH. Number 4, reaching and maintaining a healthy weight. And last, number 5, adopting a healthful, low-fat diet and limiting spicy foods. And the last one is summary. Benign prostatic hyperplasia becomes increasingly common as men age. Many men with BPH are asymptomatic or have only mild symptoms and may not require therapy. Men who develop upper or lower tract injury require surgery. Alpha adrenergic antagonists provide immediate therapeutic benefits and are first-line treatment for smaller